it's Lisa Salberg. It is August 19th, 2022, and you are listening to Tales from the Heart, a podcast from the Hypertrophic Cardiomyopathy Association. And today I am joined by three of our HCMA volunteer discussion group leaders. And we're going to talk a little bit about the discussion group process and what their groups focus on, and teach you a little bit about how you can get yourself engaged in one of our discussion groups and why you might want to do that. Excuse me, I'm still doing a little COVID cough. I do want to take one moment on a personal announcement. Today would have been my parents' wedding anniversary. I was trying to calculate how many years. I think they would have been at 66 years this year. I'm sure one of my family members will call and correct me on that one if I'm incorrect. But happy heavenly anniversary, Mom and Dad. I hope you're having fun today. And I miss you. So discussion group. So my dad was the one in my family who had HCM. And I think when you look back, he was my first support group because he was the first person that I could kind of talk to about all this. But it gets complicated, and maybe sometimes you don't want to talk to a family member about your HCM. Maybe you want to talk to somebody else who's been there with you, but maybe from a different perspective. And that's kind of where the discussion group concept was born. And it's grown from there. And I'm not going to call in the same order that we did this in practice, just to keep everybody on their toes. So I'm going to start with Trudy, and Trudy has one of our wonderful HCMA backdrops behind her today. Mm-hmm. And I'm going to ask her to tell us a little bit about her HCM experience and her group, and let you understand what these discussion groups are all about.
Okay, my name is Trudy Tynan. I live in South Hadley, Massachusetts, and my discussion group is called Symptoms. And Lord knows I'm probably very comfortable talking about symptoms because, like many of us, I have a lot of them. And many of them are very annoying. I'm a retired journalist, 30 years with the Associated Press. And now I work as a part-time writing tutor at a community college. I gotta keep going. I was diagnosed at age 60, which was 16 years ago. And let me tell you a little bit about the group, because it is something that has a little surprised me. I was a journalist, so I wanted to get the facts. I looked up all over the HCM website, which is wonderful. Absolutely wonderful source of information. And I was all prepared. And then I discovered that many people call in or just want to talk because there's that awful feeling of aloneness. That after you're diagnosed and you realize there's nothing that can be done about the underlying disease. They can do something about symptoms, which is kind of the fun part of my talk, but they are also debilitating. And that loneliness is so difficult to overcome. And that is one of the key our discussion groups can do. We're not scientists, we're not doctors, but we can tell you, I've been there.
Just hit your mute button, Trudy. You must have hit your keyboard because you went on mute. We want to hear what you had to say. You're still on mute. We'll get that fixed. Trudy, you're still on mute.
I'm so sorry.
That's okay. So we lost you when you were explaining people feel lost and they come to the symptom group to find some companionship or some empathy.
Yeah, I mean, to somebody who knows how they feel. I mean, to doctors, we often are just data points. And that's legitimate, but because they don't know how we feel. If I had a nickel for everybody told me not to panic when I got shortness of breath, I would be rich, but there's no way in hell I'm not going to panic. And realizing what we can do and what we can't do is one of the ways we begin to live again. For me, and I'll tell a silly story. It happened, I was at a symposium at Tufts University in Boston, and they were talking about HCM, mostly to doctors, but they had invited the patients. And I was sitting in a lecture hall in the afternoon. I suddenly looked around, and there were 300 other people, 300 other mutants. And that was so cool to me. I have never gone back. I'm not a moldy fig. I'm not something that should be discarded. I am special. And that's, I think, what we need a little bit. And I've talked way too long, Lisa.
No, I think you said some amazing things and you gave us an insight into the groups. And I was wondering if you could share with me any experiences that you've had in the group where you feel like you've made a meaningful impact in somebody's life by being there to listen.
I think one of the most meaningful was a young woman who had recently been diagnosed and was clearly overwhelmed. She had bangs and they hit her whole face. She didn't say anything. Clearly somebody had practically pushed her into joining the group, but she wasn't going to participate. She was just flat out scared. And I told my little story about the mutant lecture hall. And she started laughing. And that all of a sudden, she also realized she was with other people like her, that she wasn't alone. She wasn't in that awful valley of shadows. Well, there are things we can do.
And she was heard and she learned that other people had experienced similar, the same or worse, or maybe not as significant, and survived it.
Yes.
And we're here to tell the tales. So I think that's a wonderful story. And I'm sure there were many other aha moments from other individuals in your groups. And I thank you so much for being a volunteer to the HCMA and being part of that team. When can people find your sessions?
On the second Thursday at 7:00 at night. Please
East
come.
Coast. East Coast, yes. Okay, so we know you are on Thursday nights in the evening on the East Coast, a little early or late afternoon on the West Coast. Paul, I'm going to pivot up to you. So Paul can tell us a little bit about yourself and your group.
Thanks, Lisa. My name is Paul Perlman. I'm a retired attorney from Orchard Park, New York, home of the Buffalo Bills. And the discussion group that I help lead is All Things Myectomy. It's a group that consists of people who are either trying to decide whether to get a myectomy, or in most cases, they have one scheduled within the next couple of months. And for anybody who's been through that process, I'm sure everybody has questions about what it's going to be like, and they've heard this about it or that about it. And it's a little bit like Trudy said with her mutant lecture hall example. If you're considering a myectomy, you probably don't know anybody who's ever been through one. So you don't have anybody to talk to about it. You don't have anybody to ask questions about it. And so this discussion group gives people a forum where they can get in and ask questions and hear from other people who are going through the same process of trying to decide and trying to gain confidence in their decision to have a myectomy. So I co-host the group with Greg LaValle. Greg is a retired law enforcement person from Ohio, and we both have different stories. We were both diagnosed in very different ways, but there was some commonality. We had the same surgeon for our myectomy. And what we try to do is we try to start the group by telling a little bit about how we got to the point of having myectomy, and a little bit about our recovery. And then we have everybody that's in the discussion group tell us about where they are in the process. And one of the things that I've found is most useful that we've had is that we've had a good number of people who have had their myectomies, who have been in the group, and then come back within a month, come into the group, and they're there to talk to people with a very fresh perspective about what the process was like. And we always ask those folks, okay, of all the so-called advice or things that we may have said about having a myectomy, what struck you as being most helpful? And then what things were we the most off base about? Where your experience was different than our experience. And I think some of the most helpful situations in the group have been when people have come back and they almost take over as discussion group leaders, and they're talking directly with the people who are in the process of coming up on their myectomy. So it's been a very rewarding group for me, and I think for Greg as well. We've had people from all over the world participate. We've had participants from Australia and Singapore, Hawaii and Alaska, and really all over. And we've had many people come back to the group multiple times. So it's very satisfying that you have this discussion, and I think it really is helpful to a lot of people. So if you're in the process of either deciding on having a myectomy or you've scheduled one already, I certainly invite all of you to join the group. Our next one is on August 24th of this month, 7 p.m. Eastern time. Since I'm in Buffalo, we're in Eastern time. But we'd certainly welcome you to join the group. We've had people, I think the people from Singapore who joined, they got up at 7 a.m. to join the group from Singapore. So
Wow.
it's been a great experience.
If people are listening to this after the original broadcast, is there a day of week of month that you typically meet?
Yeah, it's always on Wednesday evening, 7 p.m. Eastern. And I think it usually works out to be the third or fourth Wednesday of the month, depending on how the month falls.
And everybody can check our calendar of events for when the discussion groups are available. And you also help me out when I'm unable to do the pre-myectomy planning meetings, which we run again once a month. They've been on Tuesdays. I may be shifting my days coming up in the fall to Mondays because there's some other conflicts that I have on Tuesdays going forward. But it's a once a month. If you have your scheduled surgical date, we'll walk you through. It's not quite a discussion group. It's more of a teaching group where we walk you through the process, the checklist, the emotional preparedness for going into the surgery. And I used to do them one-offs. Everybody would have a pre-myectomy call with Lisa, and I'd walk everybody through it one-on-one. There's so many of you now that's just not possible. So doing them in groups are really helpful. So if you're within the month of needing your surgery, we suggest you join the month right before, so it's all fresh in mind. If not, you can go up to 2 months before. But beyond that, the messages kind of get lost in the planning. So we recommend about 30 days ahead of your surgery, you try to participate in one of the meetings. And when I can't do it, Paul's been doing it, and we may have some other people stepping in to assist on that one from time to time. Paul, you want to talk a little bit about the pre-myectomy group? And
the pre-myectomy education meeting is different in the sense that we have a PowerPoint that we go through during that session, and it takes you through the surgery so you know what to expect, but it also has a lot of nuts and bolts types of things, such as making sure you have long power cords for your iPad and your iPhone, and just things like that you may not think about before you go. And I think those are very helpful. But as Lisa says, if you do too far ahead, you're going to forget all those things. But it's very practical, step-by-step advice.
We will be adding some segments for when I'm unable to be there live. Having Dr. Smajera from the Cleveland Clinic walk you through the surgical aspect. My belief is if you don't know what's happening, it's way scarier than understanding what's actually happening. So when I do the group, I try to walk you through each step of what the team is doing on your body and what the process is, so that you don't make up horrible things in your mind as to what might be happening, but you actually know what's happening. I've had a unique opportunity to be in the OR and watch a myectomy being done. So I give it from my vantage point when I tell the story and walk you through the surgery. And then I tried to get Dr. Smadera to come and do one with us and explain it. But we ended up talking for like an hour, and I need to cut that back a little bit because we went a little into the weeds and the details. So I got to do an abridged version in the 10-minute version of it. But we'll get that for you for the next time you do one of the groups. And thank you so much again for volunteering and being willing to step up and share your experiences with others. I love how a number of these discussion groups have partnered up with the leaders. So you get different perspectives in one session sometimes from people who've been there. And everybody has their own point of view. So thanks to Greg for being your co-host. And I'm sure we'll get the rest of the moderators on here, discussion group leaders on here in the future, so everybody can meet them as well. We've had a few of you in the past do this, and we'll have more in the future. Last but not least with us today, and then we're going to kind of get into a little bit more conversational about all this, is Lynda. Lynda, you want to introduce yourself and tell us your relationship with discussion groups?
Okay, thank you. My name is Lynda Neuhausen, and I live in the Tampa Bay area of Florida, and I am an attorney who recently has been able to go back to work on a regular basis after a very abbreviated practice for quite some time. So my diagnosis actually was only about 11 years ago, although I had symptoms much longer than that and went through many years of not being diagnosed properly. So after, things went pretty quickly after that diagnosis, and I ended up shortly after with a myectomy and then a second myectomy. And I had pretty symptomatic experience that continued on into heart failure. And then in December of last year, I had a transplant, and things are going really well. And so the group that I head up is emotional support, which has been an extremely helpful process for me, because as I help others talk about what we can do for emotional support, it has also helped me. So we, in our meetings, we talk about techniques and strategies that can be used to deal with the anxieties and the stresses and the unexpected things that happen in the journey of HCM. We allow people in our group to talk about their own strategies that they use, and it's sometimes helpful and new for the other members. And then I also cover strategies that have been helpful for me and that are helpful in general for people dealing with chronic illnesses. And in my group, we've had small group discussions. From the beginning, I had some one-on-one discussions, and one of the one-on-one discussions that was particularly interesting was someone who had just been diagnosed, and she also, this was her first attempt at reaching out to get some support, and I was actually able to help her through, the whole process of understanding and accepting the idea that, moving forward with HCM, what are some of the things that she would be expecting. The other thing that I have tried to do, and that I'm going to hopefully do more, is bring guest speakers in that are specialists in some technique or area that can help with stress and anxiety. And the one group leader that one that we've done so far was bringing in a meditation teacher, and she was able to talk about techniques and then actually do a meditation with the group, which was really a lot of fun and definitely helpful. We had a really positive response to that. And my meeting recently changed. I used to do a 12 o'clock meeting in the afternoons, and it was a little hard to bring people in, with the schedules that people have. So I just changed to 7 p.m. on the second Tuesdays of the month. And with that evening time, I'm hoping to be able to bring more guest speakers in as in the fall.
And we're looking to add some content from the HCMA side. We're working on building out a new program. It's this is kind of a sneak peek for those who are listening to the podcast today. I'm trying to build a program on developing resiliency in families with HCM or chronic illness, starting from toddlers through the geriatric age group, on some mechanisms and techniques to building resilience. Some of us have inborn resilience that we just naturally have, and others need to develop these skills. And when you're faced with a trauma, like a new diagnosis, or something has changed in your symptoms, or you're at a decision point for a treatment, it can be a real challenge to stay resilient and focused. So we're hoping to bring some programming that would kind of marry with some of the things that are in Lynda's group. So we may partner it with those groups or have those individuals come into these discussion groups on these new concepts going forward. But we have some pretty big plans for helping support families through the process of diagnosis, disease management, grief process. And that's not just from a death, that's grieving the fact that a part of who you thought you were has changed. And these are really big concepts. When you start thinking about the services of the HCMA and all of our fantastic volunteers, HCM is a heart disease. We know that, but it affects so much more than just our physical hearts. And having the opportunity to speak to peers who have been down the road and they have a little knowledge to share with you is rewarding, is inspirational, is grounding in a sense. I run a couple of groups per month myself. I do typically 2 or 3 groups in a month. I do the newly diagnosed group, probably going to be changing the availability of that to making it more available so people don't have to wait for the once a month. There might be some pre-recorded parts of that, people, but we'll be there to answer your questions. And I do the pre-myectomy, which I will probably be parting out going forward to our wonderful volunteers. And lastly, I run the transplant pathway group. I have Amy Mann has assisted me in the past and will in the future as well. And Karen Klimsak has also assisted with that, and they'll start taking steps towards running those groups. But Lynda, you were a participant in that group. So I'd like to just take a few minutes to kind of talk about Lynda, the participant. What did you get out of being in that group?
It was invaluable. It really was. So when I was first introduced to the idea that I was looking at a transplant, it was very much denial for me, that the idea that there had to be another way, that I didn't have to go to this extreme measure to be able to survive, really. So it was, and there was no one in my life that could possibly relate or understand to the idea. In fact, I never knew anyone personally that had a heart transplant in my life, and until I met Lisa. Well, I had already met Lisa, so I was on her journey with her, as we all were in the HCMA, as she went through her journey, and then of course I continued to meet other people that also were going through that journey. But participating in the group was so important because we talked to people that already had been through the transplant process and were years out of it and living full lives and active lives and moving forward with a life that none of us would have ever thought was possible. And then also people that were going through it at the time, so you were able to understand and relate to these people, and it was just so helpful. And so it was, in all stages of transplant, including post-transplant. It was just a wonderful experience to be able to be part of that group.
So I remember going through different points with you in your pre-transplant process where you were able to deal with the frustration and the fear of waiting, because it's a fearful time, with people who understood. And I remember one meeting in particular, and I'm sure you will too, where you were not in a good space and you were feeling very, very just frustrated, I guess is the best word. I don't know if you have another one for it, but you didn't see the light at the end of the tunnel. It just looked like the tunnel was just never ending. And I think in that meeting, it started off rough, and we ended with some smiles and some relaxation. The shoulders started up here and they were down here a little bit more when we got to the end of the meeting. And then within a couple of weeks of that meeting, your call came.
Right. Yes.
Just when the butterfly or the caterpillar thought it was over, it began, so we were there to watch you through that process. And then a couple weeks later, there you were on the other side in a meeting going, yep, had my transplant. Here I am now. And
Right.
it's just an amazing process to be part of, to help somebody else through what you've been through, or walk with them as you're going through it with them. So are there any aha moments that you've taken from your group, your discussions? Are there any stories that stick out to you of meaningful impact for yourself or for others?
So yeah, I think that a big part of getting ready for really for all of the big points in the journey, back when it was, when I was facing the myectomy, and then later when I was facing the transplant, there was so much emotional, it was just, up and down
Trauma.
and right. Yeah, I was going to actually say trauma, and then
Trauma.
that is exactly the right word. Because there's a time when that this is the best thing for you, but there's another time where you're just so scared, and so there was not just techniques, but just like a general acceptance within yourself, that you're on the right path and that you're doing the right thing, and so that moment of just acceptance and allowing it to happen, I think is so important to share with others, so that they know that they're going to get to a point where it's going to be okay. That I can go forward and know, that I'm going to get through this, because, all these other people have. So I think that is what I try to share with others. And in a few cases, I think it was an aha moment for several of my participants, when I'm able to share that with them.
So I talked to you guys before we got started here, and you just mentioned the topic again, and that is a little bit of competition, a little healthy competition. And I say that in saying that, I had a transplant, I survived it, you will too, in all likelihood. We can't guarantee anything. We know life is life, and it's a little unpredictable, but statistically speaking, I got to the other side, you got to the other side. So the person who's coming in is like, if they could do it, I could do it, because, I'm me and they're them. So I love that. I want people to say, if they can, I can. And I've watched people one person in particular told me he would never have a myectomy. He had a myectomy. He survived it. He's like, all right, I did it. Then he was never getting an ICD. Never. And then he did it because I did it and he could do it. I'm like, okay, you did it. And then he went to transplant before me. So then he comes in, like, when I got listed, and he's like, well, if I could do it, you can do it, Lisa, because we were having these conversations. So it lets you know what's possible and how to do it the least intrusive way possible in your life, right? How do we live with HCM and not constantly in fear of it? And these groups, I think, help do that. Paul, are there any aha moments you'd like to share from meeting participants?
Well, kind of along the same lines, we had somebody who had been in our group before their myectomy. This person was 75 years old, was going to have a myectomy, and was worried about all the normal things that everybody worries about. And 10 days after the myectomy, this person came into our group and told us that, well, we had advised you might want to rent a recliner to sleep in. And this person said, well, I had rented a recliner, didn't need it, sent it back. And within 10 days, this person is walking, half a mile to a mile, was just doing great. And I think that when other people view that in the group, they say exactly what Lisa's saying. If that person can do it, I can do it. So it's great. You know, Lynda, you said people come back to your group after they've had a transplant. And I just think it's great when people do come back, and it kind of sends that message. I could do it, so can you. Because, you know, so many people, when they hear that they're going to face a myectomy, and I'm sure even more so with a transplant, they're in denial. How did I get myself in this position? Do I really have to do this? Isn't there some other alternative?
Yeah.
So it's working through the process with them, and it does work.
I certainly think it does work. We have had several hundred, I think we're approaching 1,000 participants right now in our discussion groups. They started through COVID. It was a little, first launch, admittedly, was a little rough. We didn't quite know how to get you all to know that they were happening. And now we regularly have groups of 10, 15, 20. I think the largest I've had is 27 in one group, but they meet regularly. So if you miss one, just go to the next one. But please do not sign up for everything and not show up. If you're not going to come, please let us know that you're not coming, because we do cap the size of the rooms at 25. Beyond that, it's very hard to manage that many people in a discussion because not everybody gets to be heard. So when we start to have those rooms filled to capacity at a regular basis, we're going to add some new rooms and some new topics. And I encourage you all to share your ideas on what you want in a new group with us. And then the moderators of these groups, the discussion group leaders, we're going to be having a meeting soon to reevaluate topics and see who might want to take on some new topics. I might be developing some, maybe not regular discussion groups, but maybe quarterly discussion groups on topics of specific interest where we're probably going to bring in some specialists. I've had a number of requests that are a little difficult for people to talk about. And it is intimacy in HCM and how to strike a balance and have a happy, normal sex life with your hypertrophic cardiomyopathy. Not exactly a topic that every discussion group leader is going to want to talk about. So I'm putting on my big girl pants, and we're going to bring in some professionals to have that discussion because it's a really important part of life. So that's one topic. Another topic, which I've always had the philosophy that we should all be communicating together, meaning caregivers, family members, diagnosed people, we should all be communicating together. But I had a call for family member only groups. I think there's value there, but I also think that we're missing the opportunity for communication. So we're going to try to find a balance of how can we start to facilitate communication with our caregivers and our friend circle so that they understand what it's like to be us and what we need from them and what they need from us. Having HCM, how do I express this in the right words? I try and sometimes they don't quite work. We have a certain degree of control over our own bodies and our own choices, but HCM has its own mind in a sense, right? It does what it wants to do when it wants to do it, whether we want it to or not. So we can control certain things like staying well hydrated or not overexerting ourselves in the heat or making sure we're getting proper rest and taking our medications and listening to the doctor's advice. So we have a little control. The people who love us most have no control whatsoever. And sometimes that's frustrating to them. So we need to be respectful that our disease process is impacting those who we live with and share our lives with. So how do we balance what we need from them, but also remember we need to listen to what they need from us. So I'm trying to strike a balance for a discussion group in that space. And it's kind of hard to find the right mix of leaders for that group and finding the right audience to give it to. So we're going to be working on that. If there are other areas that you're interested in and you're listening to Tales from the Heart, we encourage you to share your ideas with us. These are volunteer projects. So we need to find people who are willing to take on the work. And then we help facilitate everything on our side. We have had nothing but wonderful feedback from all of the participants. We knock on wood. We've all, the groups have run well. The moderators are run well. The feedback has been great. We just need to reach more people. So come join us. And Any other thoughts from my panelists today on their group? Trudy, did you want to say something?
I do, because I just want to make a reminder that we talked a lot about myectomy. It's not the only thing that happens. I had an alcohol ablation, and that, although it sounds less difficult, I was just as scared as anybody. And partially because they couldn't do an myectomy. I was in too poor condition to withstand heart surgery. But we all have different things. We all, so it's not just myectomies.
It is not. So we have people who have gone through alcohol ablations, radio frequency ablations, atrial fibrillation burdens, managing from one medication to another. I did have 1 or 2 requests for a group specific to a particular medication. And I'm going to explain why I'm not going to lean into that one right now, but I want to give you my rationale. It requires a little bit of a history lesson. Sorry, people. Back in the early 90s, dual chamber pacers were going to be the fix for hypertrophic cardiomyopathy. 30 years later, we barely use them. They were not the panacea once thought to be. And it wasn't the thing for everyone, but it was the thing for some. And it still is. Late 90s come around, alcohol ablation pops in the United States. It again was thought to be the thing for everybody. And it got probably overused for a while. And then it fell back into its proper place. And it's still a great therapy for some. And it's not for others. Myectomy, same thing. ICDs, everybody doesn't need one, but if you do, you need to know what it's all about. So there's a new drug, the myosin inhibitors are out. People are starting to use them and they want to talk about that. From experience with the dual chamber pacing experience, people were talking to each other about how well they felt. And there was a huge placebo effect that confused science, that confused the patients. But I have this new thing. I'm supposed to feel better now. It's very important to let everybody have their own process and work with your physician, manage your symptoms. We've seen a lot of great successes with the new drugs, but I've seen some people, it didn't work with them and they're not tolerating or they've had nasty consequences. So I don't think it's a great idea to complain about a particular drug or praise a certain drug or therapy over other alternatives that might be available. When you're talking about an intervention, surgery is surgery. There's a process. Alcohol ablation is a process. It is a thing you go through and mentally prepare for, have the event and move on. A drug is a little bit different. So you might disagree with me on this one, but I think based on the history, I don't want to lean into a placebo effect. And I want everybody to have their own experience and then we can share the data once it's able to be published and we can look at groups in that sense. So medical management of HCM, that's the discussion group that you want to talk to. And you want to go into symptoms because we're trying to limit symptoms with these medications. This is where you can talk about what your experiences are. But if you try to get together as a group who are taking one particular drug or one therapy, trying to talk each other into or out of anything, it's going to be a little maddening and confusing. So I don't know if my discussion group leaders have any comments on that. You're perfectly able to agree or disagree with me, whatever you think.
I think it's important because we are all individualist. They still have not found the exact genes that cause our difficulties. We can have the same genes and have different effects. And one of the things with symptoms is you have to be a little patient. And you have to be able to work with your doctor, or at least question them, because you try one thing, it might work. So if it doesn't, you try another thing. And it's sort of like a mechanic fixing a car. You try this, you try that. And sometimes, often, very often you get to a point where it does help.
You need some patience there. You definitely need some patience. So just talking about the Camzyos thing for one more second. I do not believe that myectomies or alcohol ablations are going away. I think everything has its place in the toolbox, and we need to deploy those tools appropriately based on the individual patient's needs and expectations for their life. So look at the whole toolbox. Don't think you want something because you want it because it's new. Look to see what's going to work with your anatomy, with your life, and work with your team to come up with the best decisions. So I'll get off that soapbox now. We do have a couple of comments from our viewership today, and one of them is really sweet. Esther, who is also a transplant and has participated in the groups. She went through it because I went through it, and if I could do it, she could do it. And I've known Esther since she was a very, very little girl. And she's all grown up now and mom of her own with 2 kids, and had to go to transplant. And because others went through it, she knew she could too. So thanks for sharing that, Esther. We have somebody who's waiting to get their defibrillator. So we do have a group that talks about life with ICDs. I'd encourage you to join that group. Make friends with the concept of your device before you put it in your body. It's there to be your friend and your protector. It's not to be invasive. So make sure you get the right mindset before you go in. It makes the process so much easier. I had 5 devices in my life. It's kind of weird not having one. That was my transplant moment. Like, oh God, they're sending me home without a defibrillator. Can I do this? Yep, we can. So we have somebody newly diagnosed as well. Diane says, thank you. We've listed the link. And that's about it. Any other comments from our gallery?
Yeah, I will mention something that kind of ties into a lot of what we said so far is these groups are helpful in the decision-making process that comes along, like, do I need surgery or don't I need surgery? Should I go here for care? Or should I go there for care? Or should I change to where I get my care? And I think that the important thing is there's so many of these groups that talk about these topics, and you should look at them as a way for them to support your decision, not give you the answer. So these groups are helpful to know that people are with you in your decision-making process, and they can give you ideas of how to make the right decision, but ultimately that decision is going to be up to you, and no one can tell you that this is the way to do it, or that is the way to do it, or this is the place to go.
So that reminds me very much of what we do here every day at the HCMA. I think I start off almost every phone call when I meet somebody saying, I'm not a doctor, I'm not a nurse, I don't play one on TV. I'm a patient advocate, and my job is to help you make the best decision you can make for yourself and your family, because we have specialized knowledge in all different aspects of hypertrophic cardiomyopathy you might not even be aware exist yet. So when we're opening the door and saying, well, yeah, the doctor said you need this procedure and here's the guidelines, and they say it's an option, but there's also these options that you might want to ask about, because if you go ahead and you do something invasive, it's done. You can't go back afterwards and say, I don't want to do that anymore. Let's undo that. You have a decision point. So make sure you understand what all of your options are. And a little history lesson. In 1996, when we started the HCMA in our work, there weren't a lot of options. The toolbox was pretty bare. We had surgery that was done in very low numbers, and the outcomes weren't still great back then. We didn't have alcohol ablation yet. We barely had these dual chamber pacers, which everybody was like getting them put in like candy, which they probably didn't need at the time, but we didn't know that. And we had beta blockers and calcium channel blockers and some antiarrhythmics. That was it. That was it. We didn't have enough to make the decisions that we needed to make in terms of data. We didn't know who was at high risk of sudden death. The risk calculators haven't been created yet. We were shooting in the dark. So we were building this arsenal and filling the toolbox with diagnostic tips, with better understanding of MRI, with better understanding of stress echoes, with better understanding of outcomes from different anatomies. And today we have a toolbox that's loaded. There's lots of options. It is not one size fits all. It's understand your anatomy, understand your risks, know what your access points are to healthcare professionals who truly understand HCM, and taking action. And making those decisions is tricky. And that's why we've created the system of discussion groups with knowledgeable people who've been through the process themselves, we do have an inordinate number of attorneys on our discussion groups, which I find amazing because, you know, attorneys tend to be risk averse people. And you're there talking about something very personal and how you made your decisions. But we know we're not telling somebody what to do. We're saying, this is how I made my decision. This is why. And you might want to consider these things. And this is how I felt better about it. You might want to consider these things. Paul, any other thoughts from you? One of my attorneys?
Not so much on that topic, but I think it's important to let folks know that these group discussions are confidential, that the information that's discussed in the discussion groups is not put out there or repeated, or isn't even repeated in other discussion groups later on. And I just think it's important for the people who are in there to know that it's a place that they can say whatever's on their mind.
Mhm.
Absolutely. Absolutely. And speaking your mind isn't always easy when you have a chronic illness, and maybe communication isn't flowing as smoothly as you would like with your chosen healthcare provider. And talking to your peers can help that communication become more natural and flow better. Because if you're all on the same team and you all understand what your objectives are and you all have realistic expectations of what's possible, then you can make great decisions. And that ties into the guidelines in the concept of shared decision making. And we want to make sure that you can actually share in that decision making at the highest level possible. Physicians have lots of technical experience, training, and abilities, and they're expecting you to become an expert because you're the one diagnosed with it, without providing a lot of the tools because they don't have a lot of time. So these discussion groups support that physician communication by helping you prepare for meaningful conversations with your chosen healthcare providers. I'm going to start wrapping this up now, reminding you all to go to the website at 4hcm.org and register for some of these discussion groups. I thank every one of our moderators, discussion group leaders, those who stand in for me when I cannot do the meetings that I'm scheduled to do because I'm called elsewhere. It is a team. It is an amazing community that we've built here. And while I might be the founder with the vision, a vision doesn't happen without trusted volunteers and supporters who are there to do the work with us. And I appreciate you all more than I can probably acknowledge at this moment. You're helping my dream come true to help other families with HCM not have to be alone through the process. So from the bottom of Brandy's heart, I thank you for all of that. I do want to just make a programming announcement that last night we held our Big Hearted Warrior Tour special edition on genetics. It is available on Facebook right now. It will be available on YouTube shortly. And I encourage you all to start taking a look at that because, ladies and gentlemen, things are getting interesting in the field of genetics. Genetic therapies are coming to HCM, not tomorrow, but soon. And we as a community need to be prepared to have important conversations with our healthcare providers about potential new treatment pathways that are evolving as we speak. But we don't want to wait till they're here to learn about them. We want to start understanding the process now and frankly, help drive the innovation to give us the results that we want. So please go watch that. I will be back in a couple of weeks with another podcast. The podcast schedule is going to shift around for the fall. We're very, very busy. I will be going to Sweden to speak at a summit called Focused Patient, where we are going to start building out our HCMA community and including more international programming into the HCMA. So yay, we've been working on this for the entire time of COVID and beyond. And it's nice to finally be able to get out of the country and go start some of these programs. I may try to do a podcast from over there with some of our Swedish patients, and that'll be the beginning of October. And on October 22nd, for those of you who are in the North Jersey area, we are having a fun event. It will be a small ball. It is called Unmasking the Great Masquerader Ball. Think of eye masks, not face masks, but we might need those too. Cocktail party honoring our 4 local to the region of the the New York metropolitan area centers. We will be recognizing NYU, Morristown, Westchester, and the newest addition to our team, Columbia Presbyterian. So representatives from each of those centers will be on hand, and we hope that those of you who are in the North Jersey area or those want to travel here, it's a beautiful time of year in beautiful time of year in northern New Jersey. The colors are going to be great. The weather should be perfect. So come on into Jersey. We'll be at the Sheraton Terra in Parsippany, and I hope to see you all there. I will be in cocktail attire as the Queen of Hearts. So I hope you can join us there. And if you can't join us in person and want to support us, we are collecting silent auction items for fundraising. And the majority of the proceeds from this particular event will go to fund the Lori Fund, which will start to provide micro travel grants to those who cannot get to Center of Excellence Care because of lack of financial resources. So please support us. Please support your fellow patients. And I appreciate you all being with us today. Paul, Trudy, Lynda, thank you so much for all you do for the HCM community.
Thank you.
Thank you.
Thanks, Lisa.